our big intestine or digestion. So overall guts improvement, we need to know about how these fiber help us. So let's go into the presentation. Is it sharing, doctor?
Yes, sir. Yes, sir. Able to see.
Okay. So today's topics will be all you need to know about the fiber. So it will be a very straightforward and simple presentation that everyone can understand. So if you feel that something that more technically, do ask us after the presentation, and we will explain to you how this fiber works for you. All right. So there's a groundwork that said that a groundwork of all happiness is a good health. That means we need to be happy in this world. We need to obtain a good health. That is most important. So without a good health, we does not can get any good lifestyle. You know, for example, if you are sick, you are very sick, no matter how much money you have, how much income you earn, how much fame you have. Let's say you doesn't have the good health, then everything is gone. That's the reason why we always emphasize to have a good health in life. And these platforms help you to understand why we need to obtain this. So that is the reason why we put there groundwork of all happiness is a good health. So okay, today let's talk about this nutrients called fiber. So what is fiber? Fiber is a dietary fiber known as a rough edge of bulk, include the part of the plant in the body that can't digest or absorb. Unlike other food components such as fat, protein, or carbohydrate, which can break down and absorb, fiber cannot be digested into the body. Instead, it only can pass through our stomach, small intestine, colon, and out of the body. So very easy to say is fiber is something that very important for the gut to remain healthier. Actually, there's three types of fiber available for the body. We're receiving these three types of fiber. One, we call it a soluble fiber. Another one, you call it insoluble fiber. And third one is a fermentable fiber. There's a three types of fiber. So what is soluble fiber? Soluble fiber is a fiber that dissolved in water. In a form of gel, it becomes a gel. The reason why it's become soluble fiber, it can help you to lower the cholesterol level, glucose level. Where this soluble fiber can get is from the oats, from the peas, beans, apple, psyllium, carrot. This is some of the where you can obtain this soluble fiber. Another important fiber that our colon needs is insoluble fiber. This insoluble fiber is help to promote the material through our digestion system and to increase our stool bulk. So it can be benefit for those who struggle with constipation, irregular stool, and where you can able to get this insoluble fiber is from the wheat flour, wheat bran, nuts, beans, from the vegetable, from such as cauliflower, green potatoes, and all these are called insoluble fiber. In another term, that soluble fiber is something that can digest, it can put in the mix with the water. Insoluble fiber cannot mix with the water. Very simple terms. The third most important, this is a very important fiber that everybody needs. We call it fermentable fiber. Fermentable fiber is a fiber that resists to digestion and absorption in a small intestine, but break down by bacteria in the large intestine. This is the reason why we need fiber. We need the fermentable fiber. This is the reason. Because our main important organ in our body is our fermentable fiber, something that we can. Yeah. Fermentable fiber is something that the fiber that can, I will explain in the way, you can understand later. So I will explain to you in the way, what is the fermentable fiber. So fermentable fiber, actually it is called it prebiotic. So you understand the prebiotic? So prebiotic is a fermentable fiber. So what is the reason we're using a prebiotic? Prebiotic is the way where we can use it to provide energy for the cell in your colon, to promote the growth of the good bacteria, to help to regulate the insulin sensitivity and the immune system. Where this prebiotic works is to enhance our probiotic. Probiotic is a bacteria that grow in our big intestine. When we doesn't have this probiotic bacteria in our big intestine, this is where our big intestine become a problem. Why? When there's no probiotic properly in our big intestine, this is where our movement of the stool becomes slow, where you have a lot of constipation problem, where you start to receiving this best bacteria into our system. So when we have this prebiotic, we call it fermented fiber, we can enhance this probiotic to grow in our big intestine and to help you to stimulate our movement, to retain the water in your stool and bulk up your stool. So this is how the probiotic create the bacteria in our big stomach. This is just a small scale you can able to see. This is where the bacteria is grow in our big intestine. For the body to promote this bacteria, we need this prebiotic to promote this probiotic. Okay, where this fiber, all these are the fibers that outside. So if you want the fiber to get into your body, this is where some of the fibers that is already in outside. It can form in tomato, we having in berries, in nuts, in psyllium, vegetable, fruits. All these are the fibers food that available in the outside. So the reason, another important why we need this fiber, what is the benefit you need to have for the fiber? What is the benefit? So the health benefit for the fiber is, this is the most important, foster a diverse or happy gut microbes. When this is what I'm telling just now, the last thing I'm telling, the fermentable fiber. When we never get this fermented fiber, we never get the plenty of this fiber cannot promote a good bacteria in our big intestine. That is the reason why we need this fiber. Getting a plenty of fiber as well as a variety type of it means you're passing along a plenty of food for this good bacteria to grow in. So if it does not have this bacteria grow in your big intestine, that's the reason why a lot of people having the stomach issue. You have a constipation issue, a lot of other digestion issue because of it does not have this good bacteria grow there. Another important why we need fiber is the fiber will help you to lower your cholesterol level naturally. Especially our soluble fiber. Soluble fiber help you to lower the total blood cholesterol level by lowering the LDL or bad cholesterol level. Studies also shown that high fiber food may other help also for the heart health benefits such as reducing the pressure and also inflammation, mostly for the soluble type of fiber. So other things is normalize the bowel movement. This is the important for the movement. A lot of people we are always complaining to us that I have this cannot have a constipation problem. I cannot go to the pool for 3 days, 4 days, even 1 week. You cannot. Why? Because your body is lack of this fiber intake. Nowadays, all the food that we are taking now is lack of fiber. We are taking too much of sugary food without the fiber. That's the reason why we're having these kind of issues. So when you take a lot of fiber type food, it will help you to normalize the bowel movement. So it will help you to loosen up, watery the stool, so that the movement of the bowel is better. You have a better movement. The fourth is keeping you full always. This is mostly for the people who want to sustain the right weight. Most of the people, why we are taking too much of food, we are constantly craving, constantly you want to eat. Why? Because you are unable to get the full in your stomach. Even you take more fully food, but we are always taking the carbohydrate food. So this is the reason why even you are full, sometimes it does not enough for the energy supply. So when you take along with fiber food, mostly fiber type of food, you'll create the fullness in your stomach. So when it creates the fullness in your stomach, it will help you to lower the intake of food. So it can help you to prolong the intake of food, and indirectly will help you to reduce the inflammation, reduce the other type of food. So that's the reason why we need to take a lot of fiber type food. So it enhance also can help you to control your weight gain. Because when you take too much of food in too short of time, it would help you to make your body fat, because you're taking too much of food in a short period of time. But when you take fiber type food, most of the fibers will help you to full, you unable to take more food. You are not tends to take a lot of food. So it help you to lower the intake, and also can help you to control your weight and also enhance your weight loss. Another very important why always we suggest people to take fiber type food is it can help you to control your sugar level, especially people who are having this diabetic and sugar problem, insulin resistance problem. We suggest to take a lot of fiber food, so that can help you to reduce, because it help you to slow down the absorption of the sugar in our stomach. So when you take a lot of fiber food, this fiber will prevent the sugary food to enter into your stomach very fast. So it will help you to control your sugar level and help you to manage your sugar level. This is the reason why we always suggested a lot of people who are having diabetic, try to take a lot of fiber food to help you on this, especially people who are having this type 2 diabetic. Another very important is, that's what I'm explaining just now, to achieving the healthy weight. That's the reason why we are using the fiber as helping you to promote to weight loss, because the high content fiber, which have a low we have a low energy, but fiber contains a lot of energy, can give you a more fullness or more volume for the food you take. Even you take a very small amount of food, but when you increase the intake of fiber along with the food, like what we are doing, we are taking any food, but we add with our VCO or anything, our fiber food will improve the volume and promote the fullness in the body and help you to gain the right energy. So this is how we can achieving our healthy weight. So in another way, we are telling to everyone that our health is our wealth. So where this health comes from is mostly from our guts. So when a lot of people having these healthy issues in the world, is because we're having a very poor digestion. That is the reason why we always, when we want to improve our health, we need to touch this digestion first. This, if you can improve your digestion, especially your small intestine and big intestine, you can able to tackle a lot of these health issues. So one of the best solution for help you to promote this health is fiber. So as for DXN, we are in DXN, we have a very fantastic, one of the best fantastic food in the entire generation of food of DXN. We call it micro veggie. This is one of the best food I ever have. As for me, it's one of the best food I ever have, because it contains of 23 type of ingredient made of fiber in one bottle. Just imagine and see 23 type of food mixed together to become one superfood. That's called micro veggie in form of fiber. So this is very small. I'm going to talk about micro veggie very, very simple form because there's a lot of things inside the micro veggie which is very difficult to explain because we take a lot of time, but I will give you very simple way. DXN micro veggie is a specially promoted high dietary fiber food mixed from 23 natural ingredient range of vegetable, mushroom, herbs, fruits, and spices. Just imagine everything that whatever we have in our kitchen, when you start to cook, is already in microwave. Just imagine everything. I will put you all the ingredients just now. And it's completely sugar-free, cholesterol-free, low in fat, sodium, high in vitamin C, high in calcium. Lot of nutrients is already inside in the micro veggie. And it is very super easy to consume anytime, anywhere. This is the ingredient we have. I cannot put the photo there because it's too many and too much in there to explain about all these ingredients. What do you want? We already have spirulina there. As you know, spirulina is a superfood. It's already there. Noni leaf. We know about noni. Another super wonderful. We have lion's mane there. We have a psyllium grain there. We have celery there. We have a mulberry there. We have a ginkgo leaf there. We have ginger. Ginger is already there. Lemongrass. Another powerful mushroom called shiitake mushroom. Powerful for immune system. Shiitake mushroom there. And we have 7 types of mushroom there. Limpolium mushroom there. St. George mushroom, eel oyster mushroom. All these mushrooms which are already placed in the micro veggie is mainly for the digestion and for all the small intestine and big intestine. And we have a sweet corn. We have sweet corn there. We have lime. We have orange. We have green tea, we have papricum citrus, we have red tea, we have star anise, we have clove, we have cinnamon. Everything is already there. We have all the spices. Everything is already placed in one bottle, which provide you the enough fiber for entire age. The best thing in DXN micro veggie is we have the 3 main fiber that what I explained to you earlier, which I tell you that we have 3 fiber which we need. We need the soluble fiber, we need the insoluble fiber, and we need the fermented fiber. The 3 fiber is already in micro veggie. So what else you need? This is a complete fiber food that what the body needs. What we have to do is we just have to drink this micro veggie into the bowl every day in our food. We can got enough fiber intake. So I will explain to you another 2 types of fiber, which also small contains of fiber, which already have in our spirulina cereal and also in a cordyceps cereal. These 2 form of food also contains of a much needed fiber, but not as much powerful than micro veggie. So you understand why we need this micro veggie. This micro veggie you can take anytime as you like. So what is the best time to take micro veggie? Always people asking me, when is the best time to take micro veggie? Every time people will ask me, the best time to take micro veggie? So best time to take micro veggies is anytime. Anytime is the best time to micro veggie. It means micro veggie is a fiber food. So I personally will take how? When I take my rice or any food, I'll put micro veggie 1 spoon into the food and mix it together with VCO. Mix in the food, I will consume the food by itself. Because the food, whatever we are taking, we always lack of this fat and also we lack of this fiber. So when you complete this put inside the food, it becomes a complete food. So you can. Other type of way you take the micro veggie is by taking in a drink. So before you taking any food, you can able to take your micro veggie first, then you can able to consume any food. It also promote a good, easy digestion. So another way is just take the micro veggie, hold inside your mouth, put a little bit of water, shake it, then you swallow it. It also works. So there's no such one way to consume our microwave. So you can consume any way to consume this microwave. Another one more way I'm always using is in the morning. I'll use this as my breakfast. I'll use it our VCO mixed with our micro veggie in a coffee, shake it and drink as the smoothie. I'll drink it in the morning. So it will it will fill up my stomach, so I does not need to take my breakfast. Sometimes if after this meeting, I'm going to take another one more micro veggie as my dinner. So it promotes me to help me to fill up my stomach, to promote a good bacteria for my stomach, to help all this. So this is how you can able to consume this micro veggie. So I hope this explanation will help you on this. So because it's very simple and straightforward, even the fiber is very, very important. The reason why we always emphasize people to take fiber is this is the one nutrient that always people miss. Fat also people might take, but fiber people always missed. That is the reason why all the people be having this constipation issue, digestion issue, so many other issues. So that is the why we need to do that. So very difficult to explain each and every single nutrients in the micro veggie. If I want to talk about each and single nutrient, it will take another half an hour. So it's very difficult for people to, so because every single nutrient in the micro veggie, the 23 nutrients, they have a special characteristics. So we does not need to understand all these things. We need to understand that when you take a micro veggie, you get these three type of nutrient, what we call soluble fiber, you got the insoluble fiber, and you are receiving this fermented fiber. Because the fermented fiber is the most important one because it will promote your probiotic. So this probiotic is very important for our good bacteria in our stomach. And this is where a lot of people having this problem. So this is a small, simple presentation. I hope people understand. If it does not, please do ask me after this session. Thank you so much. Have a great day. So I'm passing the session to Dr. Fridas now.
Okay, thank you. Thank you so much, Mr. Nixon.
Thank you, sir.
Okay. Yeah, thank you. Right. It's a great session and very brief and very simple explanation. I believe that everybody could able to understand. Okay. So how important is microveggie? So let's go into the Q&A session. So there's any Q&A questions, Mr. Sam or
Doctor,
Madam Parimdam or either
morning, doctor.
you got to change group, Mr. Sam.
Doctor,
Yes.
doctor, so far, no question, doctor. Only one question is from Sammy Yadav. It is not, microveggie not available in India. So that is the only query so far, doctor.
Okay. Yes. Microveggie is not available in India. That is true. But soon, okay, now only they have set up the factory and slowly things are getting rolling. And definitely, by this year, most probably the company is in fact trying to come out with all the products as fast as possible. And the only problem is DXN has quite number of products. So, and also this is depends on government approval. Okay, if government said tomorrow you can bring all the products, and definitely you will have everything what we have in Malaysia, in India, definitely. But that is not possible, right? So every country has their own regulation. But through your leaders, we could able to ask for their favor to get it from the nearby countries, okay, which is like Dubai, Malaysia, or this kind of arrangement could able to be done. But that is no promises, depends on the availability and also the leaders, time and everything. Okay, so but just as a knowledge, so you all can enhance this practice. So, but if you don't have microbiology, what are you going to do? What are you going to do? Okay, you see, the fiber, every single fiber that you consume, who is going to eat in your body? Okay, you see, now when you get hungry, you eat, you need nutrition. You're giving nutrition, you're giving vitamins, minerals to the body, right? Same thing. So here, the microbes in the intestine, which is your bacteria, the good bacteria, they need fiber. Once you give this fiber to them, they can produce amino acids, coenzymes, fatty acids, and all kind of mechanisms. And all these fellas is the one will transport your nutrition from the food. So the key player here is the bacteria, the microbiomes in your intestine. Always remember, they are the key players. They are the most important transporters. So they are taking care of their entire system. So where is your immunity? So your immunity hub, the HQ, is in your small intestine. Okay, so you need to have a very good, strong gut in order to have a good health. Okay, remember that. Okay, this is where we always claim that your small intestine is your second brain. It looks like a brain also, your small intestine. Okay, so the small intestine's food is microbiome. So if you want to sort out, okay, and also we have fibrous activities from the other source of products, such as spirulina also, okay, we're able to feed the microbes, and also our coffee, okay, they also have contains little. But if you don't have all this, you also can consume VCO, okay, and the little vegetables from out, okay, which you don't have to take in a large amount, okay. So this is how you can manage, okay, your sin. But try your best to avoid all the processed food, coloring, preservative, which anything which is labeled as a barcode, has a very long shelf life. All these kind of products should be avoided. Okay. So any more questions?
Doctor, so far, no more question, Doctor.
Okay. Since now, who would like to know about the heat? Now people say the temperature is so high and everybody is so worried about heat. Okay. How many of you put up your hand? Okay. If you no hands up, then I may not talk about it.
Doctor, both hands.
So that's it. That is consider. Okay. Now you tell them they have to put their hands up. Okay. Is it quite a lot? Okay, now what they call that heat what heat
Heat wave.
wow.
Heat wave.
Yeah, heat wave like that. Heat wave. You know. Heat wave, and I know people are very worried and people are dying and so much of issue due to these heat waves. Okay, let's talk about this heat wave. Okay, and see, I'm trying to look at anything which are able to explain to you all in a very simple way.
Okay, you all can lower your hand, no problem. You already know everyone is funny.
Yes. Okay. All right. Okay. You see, now people are very worried about the heat. Okay, every time they complain, the temperature is overshooting, and that is going to really get you into your problem. You see, human system is so powerful, extremely powerful, we're able to sustain body temperature 36 regardless of external temperature. Regardless of external temperature. Okay, you go to a winter, your body will be able to manage 36.6 internally. You go to a climate where it's so hot, it can be, 40, 41, but still your body maintain 36.6. How is that possible? Have you noticed this? And the only time when you put a temperature thermometer and you see your body temperature goes up to 35, 38, 37, 38, 39, that is because you are not well. Why does the body temperature has been increased? Because that is a defensive mode. The body is declaring a war, and to capture all the bacteria and viruses in the system, especially when you have a viral fever, the body will increase the temperature up to 39.9, 34, 30, 40, up to 40. You see, that is fever. But it has never happened. The body will increase your temperature, even the outside is 42, 45. No. What could be the reason? People are dying of heat stroke. You want to know? The reason is you are having a very, very, very poor system, a sick-oriented system, which is fully blocked. Your lymphatic system is fully blocked, which is causing a lot of malfunctions to your entire organs. Have very hard, dense blood flow. Velocity is not there. Blood resistance is so poor. All this is what causes you. See, even in this condition, okay, I used to be in hot sun. I used to even run marathons, okay, and used to spend all indoor and outdoor in many different climates, but has never encountered this. Even I go for my trek, 4 hours, 5 hours, I go without water, and I've never come across this heat-related issue. Because nowadays you see there are so many human beings who don't drink water. They don't drink water. They only drink coffee. They drink tea, colored beverages, sugared beverage, carbonated drinks. And this is what fruits and drinks are. Okay. And then eat very highly inflammatory food, obese, all these kind of sorts of issues. So this is what make them, body become overheat, and a lot of complications comes and they cause them death. Where do you really get the heat wave? In a desert, you're lost, you do not have water with you. More than 10 days, you go on dehydration, then that is a real heat wave. That you can't avoid because you don't have water with you. But now people are in the city and dying due to heat. You see? So this is not the weather. This is you. You are having such a poor system, very weak system. Nothing is really good. You see, the body has a triple warm. We call it as a triple warm. This is the department where there's, the lungs and the heart. Okay, you can see this. Okay, you see this photo. All right, okay. You see, this is the lungs and the heart. This is the upper burner. Okay, they maintain heat for your body. Okay, your body is 80% water. 80% water. And this water is stored in your lungs. So, whenever, if you are staying in a climate, hot climate countries, you naturally drink water or you drink tea. Tea is more cooling compared to coffee. So you may take one coffee, take more tea. So in DXN, we have so many different types of tea to cool the system. You can enjoy all the tea, right? But how many of you are really doing this? You are drinking everything which is very acidic. Then you also have a middle burn, spleen, stomach, and all this, the digestion area. Then you have a lower burner. So lower burner is your liver, gallbladder, kidney, and all. See, one brings in the water, one processes the water, another one regulates and flush the water out. So we have a triple warmer in the body. So when you have overheat, come again? Okay, middle burner. Yeah, middle burner is spleen and stomach. And lower burner is kidney, large intestine, liver, gallbladder, small intestine, urine bladder, all this. They are more to lower. Okay. See, when you are in this is why you notice sometimes when you drink a lot of water, okay, you've been drinking water and suddenly it rains or you get into an aircon room, your body is so cold. The body will detect and it said, hey, there is too much water. We need to balance the temperature. The body will release the water. This is why when you are in a cold environment, you urinate more. You urinate more. Okay? You urine. The body will hold your body to make it hot. And it will reduce your thirst. You'll not feel thirsty. You see? This is what the body will do. So then you go to a hot climate. But the urine is very low, but the body will make you thirsty. You see? So the heat wave and all these things hitting people nowadays is because people are... Okay. Yeah. Yeah. You see, when the body detects when you go into an aircon room, naturally you will have more urination. You will start to urine more. Okay? The reason is when your body has more water, so the body cannot hold the water because water can get cold, your body can get cold. So it needs to reduce the water in your body. So everything will be declared as urine. The water has to leave the system. It will kick out. Okay? So the same goes when you're in the hot place. The body needs water. So the body will reduce your urine output and increase your thirst requests. So you will drink more water. All right? Your body knows what to do exactly. But commonly, these heat waves nowadays are disturbing people because the body has so much of difficulties, weakness, lungs, fibrosis, too much of toxin blocks everywhere. Blood flows are not so good. You see, this is the problem. But when the body requests you to drink water, what do you drink? You drink Coca-Cola, Pepsi, Fanta, fizzy stuffs. Okay? That is wrong. That is wrong. So how the body is going to help you? So we should know if our climate is changing or either you're going out. Okay? Today, I'm going out. I'm going to be in the hot sun. So what you should do? Common sense. I should have more water with me. You cannot bring beer, liquor, vodka, and go. That is so much acid. And how are you going to, in the hot sun, if you're going to drink this, that's going to hit going to make it another way around. Now you bring some fizzy stuffs or colas and all this. No, you will need a lot of water, right? So if you are in a hot environment, very, very hot, okay, a very cold environment, maybe you need a hot cup of tea, hot cup of coffee. Yeah, just 1 cup will do. 1 cup just to increase the body temperature. You see, remember, the heat waves hits people who has high acidity body. Okay, so don't, we cannot change the climate. We cannot change the weather. We cannot change the winter, autumn. We cannot. Okay, we change all this. But the only one thing you can change is you can change yourself. So make yourself better. All right. So I believe that you understand now what is our mistakes in, okay. Okay, you see, there is one question. I'll take this. Okay, how can one who suffer from a malfunctioning kidney during heat condition, since they need to limit the amount of water and fluid intake? All right, you see, this is for kidney malfunction peoples. Okay, they cannot drink much water. All right. You see, these kidney malfunctions people, first, they have to correct their food. Stop eating rubbish. Right? This is very important. This is the only one part that nobody bothers. Lifestyle issue. You can be whatever you want. You can take whatever you want. But if you're not going to feed your body with the best of the best, no, it is not going to work. It's definitely not going to work. You cannot purify the system. So this is very important than the water. The food they eat, if they are going to eat very highly inflammatory food, drinking inflammatory beverages, eating all this kind of food, the body will release more toxin. Need more dialysis. Yes, need more dialysis, then you're going to have more heart attack. So in this scenario, what they should do, be indoor, try to avoid the heat. They cannot able to take risk. Okay, maybe frequent dialysis need to be done. 3 dialysis cannot miss. All these things can have to be done. So even the kidney patients, not only the kidney patients must maintain a good food in this heat environment. Okay, every human being should eat better. This is why even in India, those days when the temperature climate is so bad, what they do, they don't cook so much of curry stuffs. They take more on cooling things, which is more to yogurt base. Okay, they do oil bathing, okay, to release the body heat. So we have so many different types of food which can release our body heat. In DXN, Androgy is one of the best. Spirulina is also the good one. Ganodermas is also releasing the heat in the body. Black cumin also does that. Our tea, all our tea, flora tea, spica tea, oolong tea, all this does. Okay? Cut your meat. Okay? Reduce your portion of your meat. Every time I tell people take fat, but I never told you eat meat, eat fat. But you just need a 1 or 2 pieces of meat. It comes along with the fat. That is fine. So balance it up. So if in this case, definitely you'll feel very calm and very stable and very strong in this kind of environment. Okay, so food is the main role to control the body heat. So you can control the food, not the climate. Remember, now everything. You see, in Malaysia, we are so blessed to be in Malaysia. We are such a blissful country. So awesome. I tell you why. I tell you why. Everything we get equally. We get enough rain. We get enough hot sun. Like today. The hot sun was in the morning from 8 o'clock right up to 10. 10 o'clock, it starts to heavy pour until 4 o'clock. Awesome. Right? Then it a little bit of shining and then it goes off. Tomorrow maybe it might be solely hot. You see, in this kind of condition, in this heat wave, I've never put water for my plants. Because every day there is a pour. Every day it's raining. But even that they complain. Because human beings are so funny. Because they want everything to be their way. They said, morning, have good weather because I'm going to office. So they must have nice sunshine. So once you already go into the office, then you can pour, no problem. By the time when you want to go back home, no rain, please. The rain has to back off because all the kings are going back home and the rain will hold on. Once you already enter the house, your children are back, everybody is back. When you want to sleep, they must have a big rain. Why? You're sleeping, you must have a cold weather. Plus some wind. Oh my goodness. End of the day, they make this nature as our servant. God become their servant. Everything they want their way. That will not happen, don't worry. That will not happen. So, my style of doing it, if rain, awesome, lovely. If the sunshine, boom, beautiful. So if it rain, and then it's sunshine, I look for a rainbow. Hey, where is my rainbow? Must be somewhere. Yes. You see, everything is good. But, we always say God has a plan for us. But when He make a plan, nobody stick to that plan. If it is not favorable to you. You see? All right. So don't worry about heat waves. So cut your inflammatory food. Okay. And with all this, definitely heat wave is not a single issue. Even nowadays, people sweat to the complain. I don't like sweating. Oh my God. I have to urinate more. I don't like urinating. This is all this is nature calls, and it's best to keep ourselves healthy. And this is what we should have. Okay. So I guess now you'll have a better understanding. Yeah. Thank you. Thank
Doctor,
you.
Doctor,
Yeah.
one more question from Madam Puvan, Doctor.
Mhm.
A member was having severe stomach pain and
Mhm.
discomfort after taking combination of foods. So the
Mhm.
member took codipine and morinzi and experienced dizziness and vertigo-like symptoms. Why is this, doctor? Kindly suggest, doctor.
Mm, where is the question? Yeah, I remember having severe stomach pain and discomfort after taking a combination of food. Okay. See, the question is, okay, the member was having severe stomach pain, discomfort after taking a combination of food. So the member took codipine and morinzi and experienced dizziness and vertigo-like symptoms. Why is this? Okay, I explained what it could be happen. Okay, you see, whenever they have stomach-related issue, it is very much related to vertigo, sort of. It's actually not a vertigo, it's mild giddiness imbalance. It's because the vagus nerve pressure could, disturb the brain. Okay, this happens. Okay, so whoever have this very very weak, stomach, they will have this issue. See, one of the main reason for epilepsy, okay, fits epilepsy, is also stomach digestive issue. So they have very sensitive transmitters problem, and also a lot of mineral deficiency, vitamin deficiency, which is this epilepsy issues. So the first one, this member, Dr. Puvan, asked them to be very careful with what they eat because the stomach sensitivity is so bad. All right. So, and this is the issue. So they need to correct their lifestyle. So please go in again, check on all the 4 items which I always used to tell: flour, milk, sugar, and fruits. If all this is there, it has to taper it down, gradually stop it, and add on fat with our DXN, lion's meal and all. So provided if there is any medications, always try to work on that as well. If it is not really important, they can avoid that medicines. If they want to take it with food, then they might see some good results. Okay. So the DXN, once go there, it gives you vertigo because any of the good food they take, they will cause giddiness because all these good spirulina will go in and heal the problem, will start to rectify the problem. Okay, so this is why they will have this reflex. It's a healing crisis actually. Okay. Okay.
Madam, so few questions are in Myanmar language. You may ask the doctor.
In front of the house, water treatment plant in the back. It makes noise every day. Our house is cut caught in the middle. I could like to know if this is related to my ill health. Wait, let me get this question. Dear teacher, I want to ask you something. We have been ill for years, also there is rice mill in front of our house and water treatment plant in the back. It makes noise. Yeah. Okay, you see, we don't know what kind of illness he's referring to. That's one. Any info from him? Okay, okay. You see, I answered the question. Okay, it depends on what kind of illness. Okay, if there is a mill in front and then there is another factory in between his cot, there could be some kind of um, uh, problem that can cause him. But if this is related to these two factories, definitely everyone in the house could be able to have the same kind of illness, or the neighbors or the surrounding factors, everyone will get affected with the same issues. Okay, if he alone is having this issue, and I don't think so it is due to this, because based on what his explanation is, okay, there is a water treatment plant, okay, and also mill, a rice mill. So, but don't see much of a pollution either, or maybe just a noise. It could maybe disturb him and can make him stress, most probably. So what he could do is maybe he can move out of that place for a while and then see what kind of difference does he get. If say he move out and then he feel much better, say for a month or two, or maybe 6 months, he feel much better in good, that could be a placebo effect also, but it does some good to him. So maybe he could reside to somewhere that is less pollution. You see, some people can stay in very noisy environment. Some people can, you see. They can even work in a noisy environment. They also can sleep in noisy environment. They're used to it. Some people can work in a discotheque, clubs, they can. And even there are staffs can sleep in the discotheque. No alcohol, nothing. Okay, because they're so tired, they can sleep. They're used to it. Okay, so for them, it's not a problem. But for some people, you put them in a very noisy environment, even how tired they are, they cannot sleep. So their pressure will go up, the BP will go up, they get very angry, they will change, the personality can change, they'll get very tantrum, and they get very angry. Also happens. So this depends on the individual. If it is a chemical environment, say there is two factories discharging a lot of chemicals and they have some lungs issue. This is uncontrolled. Okay? So that lungs issue can cause damage to everyone in that area. So definitely this kind of issues, you can see large people. Okay. Okay. Control the problem is different. Uncontrolled the problem is different. So what I will suggest to him is do some changes on his own and also take the DXN products to support, to help the condition of the system. That's why a lot of people has this wrong understanding on DXN. They think DXN is a medicine. This is this, this is that. And that is why sometimes people take and then they stop, then they take and on. You see, since born, we have to eat and feed ourselves nutrition. What today DXN is providing is a lifestyle. DXN is giving us a nutritional food, highly therapeutical food, nothing else. Okay? You need a good coffee. You need a good tea. You have that. You need a soap without chemical or less chemical. We have it. You need toothpaste. You need skincare. Then you need some oil. Then also you need some food. And then you need some juices, some fermented item, which is all has to be good for health. So this is what DXN is giving us, a full healthy range of products to improve our health. That's all. So there is no disease related issue. But obviously anybody who falls sick need more attention, need good food to come out of the disease. So we also give DXN products to help the sick people to come out of these conditions. So where it helps them. But that's why we have mycoveggie, we have codipine. There are so many different types of beverages for everyone. You're sick, you can take. If you're not sick, you still can take. You see? So don't take DXN is more to sick people. No, it is not such. It's not like that. Erase that idea from your brain, from yourself. Okay, okay, I guess we answered all the questions. Huh?
Yes, doctor. Madam Cho, any more questions in Myanmar?
Mhm. Okay, I think this is more to the food they take. Okay, must be very high rice and sugar issue. Okay, so they must. Okay, the question is we are still following on the previous question that we discussed. You know, there's two factories. The guy is caught in between, so his doubt whether it could be the factory problem or not. But only the family, so one or two having neurosis problem and also thyroid. You see, these thyroid issues normally triggers when if you take a very high amount of carbohydrates or sugar and all this. So their neurosis is also another issue that it comes of high inflammation, inflammatory issue. So I think, you know, the family has a lifestyle issue that they need to, you know, fine tune a bit here and there. And then definitely they will able to, you know, manage this. Okay. So their only problem here is noise pollution, both. But how strong is the noise? Is another question. So advise them to go on very bring down the carbohydrates and also sugar intake, and that will definitely help them. Okay? And also increase the fat a little here and there, and they should be good. Okay.
Doctor, questions all you guided, doctor.
Okay.
So
All right. So I think there is nothing. Nothing much. Is there anything that anybody wants to ask more? You need any highlights or anything on current issues or anything also, it's fine. Okay. You can just
Somebody asked the hand raised, Doctor. Can we ask them to ask, Doctor? Somebody
yeah.
asked hand raise.
Yes, please.
One second, Doctor. Ma'am, Bond
ကဲမင်္ဂလာပါ
thought,
ဆရာမခက်ခေါက်မိခိုင်းထားတာသူ
you may
နေ
ask
လို့မရ
now.
ဖြစ်နေလို့တော်ရကြာဓာတ်စာစားတာ2 နှစ်ရှိပြီဆရာမအခုသူရေးထားတယ်ဆရာမသူကအခုဓာတ်စာစားပြီမဲ့ဖက်ကမှာ10 ရက်လောက်ရှိပြီဆရာမပျော့ခွေတယ်လက်တွေလည်းရှောင်ကိုင်းတယ်စားတော့မပြတ်ဘူးဆရာမအဲ့ဒါဝန်းနေစီးတွေလည်းမှန်ပါတယ်အဲ့ဒါဘာကြောင့်လဲဘာတွေဆက်လုပ်ရမလဲလို့ထားတာပါဓာတ်စာကကျမတို့ဒီ RGGL resilience စာတွေmorinzi lime coffee အဲ့ဒါလည်းတောက်တယ်ဆရာမ spirulina ဟုတ်ကဲ့ပြောထားတယ်ဆရာမသူလည်းပင်ခွဲထားပြီးမှရန်ကုန်မှာခွဲပြီးပြန်ရောက်ခဲ့တယ်ဖက်ကန်ရောက်နေဆရာမရန်ကုန်ရုံးရောက်ခဲ့တယ်စီချူရှိပါတယ်ရင်တော့စီချိုရှိရဆရာမစီချိုရှိတော့ဒီဓာတ်စာစားတဲ့အချိန်စီချိုတက်တာတယ်စီချိုနဲ့ဒီ metformin လုံးဝမစားတော့ဘူးနှစ်နှစ်ရှိပါပြီ
Asking a question, right?
ဒါပေမဲ့သူ့မှာကင်ဆာရှိတယ်လို့သူ့အမျိုးသားပြောတယ်ကျမတို့တော့မပြောဘူးဘောစာတအိမ်ကင်ဆာလို့ပြောတယ်ဒါပေမဲ့သူကတက်တာသွားတဲ့အချိန်နဲ့ဆရာမမလေးရှားလဲလိုက်ခဲ့တယ်လန်းဆန်းဆန်းပဲမပြောင်းဆရာမ
Ms. Cho, yeah. Yes, could you explain? We can't hear you. Okay. Okay, you see, we always repeatedly telling we are not doing treatment. We are not doing, there is no guarantee of treatment. Okay, but this person has thyroid, has cancer, is bedridden. So look like there is so many problems here. Okay, and the age factor, and what is the lifestyle is. That is the big question mark here. And what she is eating first of the day. Okay, so first we need to see is what caused the disease, what has made them become disease. That is very important. So that we have to stop that part first. So we know there's two things make us sick as per our gynotherapy: toxin and imbalance, malnutrition. So where is the toxin coming? Where is the inflammation is coming? And we must rectify this too. So that too, we must close that hole. So it's a very big hole there. Okay? So this is very important. A lot of people just don't want to close the hole. Okay? They just want to keep pouring water, and this is not going to really help them. Right? So this is very important. Okay? Let me show you this. Okay, you see? Yeah. You see, this is the person. Okay. And what is the damages? Okay. Damage other disease or sickness. Okay. What is affecting them? That is the big question mark. Definitely the answer is food. The inflammatory food. Two things, which is toxin, imbalance. So we have to find what is what here. What is what? And this we need to stop. So here DXN is coming to repair and fix and also helping here. If you don't stop here, when you're going to finish the repairing? Okay, you've got a big pail and the water is dripping. Okay, and then you just pouring some water, keep pouring water. Okay, and you don't close this, so the water will be up to here only. How much water you put, it will be keep going and keep going and keep going and keep going. So you need to stop this. You need to stop this. Okay. So there's a hole, there's a hole, there is a hole. So you need to fill this up. You close here, you close here, then DXN, then they open a new one here. Then we close here, we close here, then they open new one somewhere here. So what is the damage? The lifestyle is the biggest question. The food. So flour, sugar, milk, and also fruits, and also hospital medication is the biggest culprit. And also does a lot of side effects. You know, they have to also see, you know, is really the medication is needed or not. You see, I had also the same thing. One cancer victim came and saw me and went for operation and the operation is needed, asked her to do everything. After coming back, and she cannot eat, so much of problem. She's losing weight, you know, mouth is getting dry and dry and dry. So much of issues. Okay, and she cannot go toilet, but taking a lot of DXN products. Nothing is working as she wanted. So they came to me. Okay. So, and I'm in a situation where very highly responsible for the family. Okay. I have to really rule the issues out here. Okay. So I have to stop her medication. Okay. And some very, very damage side effects prone medications, I need to stop her from that. And now 3 days, she back to normal. She can eat well. She can walk well. Okay, much better. She got happy diet. Okay, she want food and all these things. You see? So there are so many things that we need to see. So DXN is not medicines to forcefully recover. No, it will do its part. But this is DXN. Okay, this is DXN. The holes, you need to stop. You need to damage the system. What are you eating? That's a big question. Okay, and then the mind. The mind also is a very another important thing. Okay, this is very important. This is very, very important. The willpower to live, to become healthy. This is the most powerful for them. Okay, they need to have that kind of strong willpower. Okay, you cannot just come and just eat something and then expecting some miracles to happen. Okay, please, I hope the person understand this, you know. But the willpower is good and your lifestyle is also good. And the urgency for them to recover and come out of it, that is the most powerful. Okay, and then that will happen. Okay.
Doctor, one more. Miss Choi Yu Han raised hand. Doctor, can I unmute, Doctor?
Yeah, please.
Yeah, Mr. Choi Yu Han, you can ask your query now.
Oh, Sama Minglava. Sama the Tamin de Misana in the pool party was at the she said, or the pool party at the do my Gubaki, don't we do Nis in Ahara at the Atompulo Yava the last.
Okay. The question is, there's old people, can we use myco-veggie as a nutrition? That is a question. Myco-veggie, what I would suggest is don't take it every day. Okay. Take alternate days will be good, or weekly about 4 to 5 times or so is good. 4 times, you know, it's good. Because this is your feeding fiber to your colon. You know, you don't need to feed fiber every day if you're good with your food, and then you manage this part. Okay. The reason is sometimes when we overgive fiber, people drink less water and this and that, and with the body temperature and so on, because now people have so much of problem. Okay, they have very damaged colon, they have squeezed and small colons, and all this can cause them to have more constipation. So the bowels will be a little harder to come out. Okay, so play with the dosage. Okay, as how happy is they are. Okay, that's how we go with it. And you see, DXN products, there's no fixed rules in dosage. So go with the flow. Okay, the patient is happy, good. Our job is to make them happy. Okay, that's what you got to do. Okay. Yeah. Okay, the question is, are the products for nutrition? They can choose any products they want. My recommended is most firstly is will be spirulina, fruzi, so it's very good. And they also can give Ganoderma, coffee, tea, black cumin, Even bee pollen is also very good for them. Okay, bee pollen is also good. So all this is it is good. They can give them no problem. Nutrition, everything is nutrition. Okay, yeah. All right.
Doctor, other two more
questions.
raised hand, Doctor.
Yeah.
May I unmute, Doctor?
Yes, please.
Mona, you may ask, unmute now. No?
ဟုတ်
And
ကဲ့
ask your
မင်္ဂ
query.
လာပါရှင်ဟုတ်ကဲ့အခုခေတ်မှာဆိုလို့ရှိရင်เนาะအမျိုးသမီးတွေတော်တော်များများတအိမ်နဲ့ပတ်သက်တဲ့ယောဂါတွေဖြစ်တယ်เนาะဥပမာဆိုလို့ရှိရင်တာဝအိမ်ကြီးအိတ်တွေပြီးရင်တအိမ်ချက်သားနဲ့ယောဂါတွေပြီးလို့ရှိရင်ဒီတအိမ်ပေါ်မှာအစီတုံးဖြစ်တာတွေပေါ့เนาะပြီးတော့တအိမ်ကင်ဆာတွေဒါတွေကအကြောင်းရင်းကိုသိချင်ပါတယ်ပေါ့เนาะဘာတွေကြောင့်မလို့ဖြစ်တာလဲပြီးလို့ရှိရင်ဘယ်လိုမျိုးကုသရမလဲပေါ့เนาะဟုတ်ကဲ့ရှင်ကျေးဇူးပါရှင်
Okay. You see, okay, the question is, what is the reason for women to have this, we call it PID, pelvic inflammatory disease, which is uterus, fibroids, cyst, polycystic, all these things. All right. It is very simple. I will tell you. There is only two reasons why we get sick. Okay. As per our gynotherapy, there's two reasons. Okay. First reason is toxin. Second reason is imbalance. This is nutritional issue. Okay, less nutrition. Toxin divided by two. One is oil base, one is water base. Oil base is very deep. Oil base is on the surface. Okay, very shallow. Right? So this is what Ganoderma will help. Okay. Our RG and GL. Okay. Imbalances will help by spirulina. And also all the other products. Shiitake mushroom, black cumin, Cajun plus, and everything. Coffee, tea, and all. So here also the coffee teas also comes in and help because most of our coffee have RG, have GL. Okay. So that's why we are a Ganoderma company. We are a Ganoderma company. Okay. So only we talk about toxin. Okay, only DXN talks about toxin. So when you give all the products, even our toothpaste acid, so, and they are eating too much to damage themselves. That is the problem. So we always advise people. This is why when I, in my talk, in my Zoom sessions and all my members, I educate them what not to eat. I educate them what not to eat. But many leaders are not doing this. Everything can eat. Cannot. If you are damaging yourself, this is our very precious gift from the God, our body. So you cannot keep damaging. And this side, the poor Ganoderma is keep repairing. Then you keep damage, then you repair, damage. Why don't we stop the damage or reduce it and then repair? So you get improvement. You get more better. And that's what we want. Okay, so all our products are good for everything. Okay, everything can do the job. All the products can do the job. So what you should do? Adopt a good lifestyle. DXN is a way of life. So adopt a good lifestyle. Okay, and then share with a lot of people. Whoever don't know about DXN, share with them what is DXN is all about. Okay, you have to bring to them a package of lifestyle. Okay, a good lifestyle, healthy lifestyle, health, wealth, happiness. Okay, that's very important. Okay, so remember, all these fibroid, cyst, polycystic, everything is toxin. Whatever grow inside, that is toxin. Okay, maybe one day we will do gynotherapy session, which will be a little longer with translation. We will do a very huge session, maybe like 200, 300 participants. Okay, with translation, English, Tamil, Malay, Myanmar, Burmese. In this gynotherapy, you will get a lot of ideas and knowledge. Okay, so all right, one more person. After that, we will end the session.
Yes, doctor. Last person, Momo Lin. Mr. Momo Lin, you may unmute now and ask your query.
ညီမဟိုပါတလောတော့မသိတာမျှဝေပေးလေဆရာမိုက်ကိုဘက်ကြီးကိုတောက်တဲ့ခါကျရင်ရေအေးနဲ့ပဲဖြိုရမယ်ပေါ့နော်အခုကပေါ့နော်ကော်ဖီနဲ့လည်းတောက်လို့ရတယ်ဘာညာပြောတဲ့ခါကျတော့အမတို့ရေအေးပဲရတာလားရေချက်သိမ်းလို့ရောဖြိုလို့ရလားအဲ့ဒါလေးသိချင်ပါပါ
Okay. All right. The microVG, yeah? Okay. Okay. Yeah. All right. The question is, can we mix microVG with coffee if the coffee is very hot, and will that maintain the efficacy of the product? Okay. Even our coffee, you don't mix with boiling hot water. Remember that. Okay. Or hot water at your drinking level. Okay. So any water, hot coffee that you make, you should able to drink it immediately. That is the right temperature level. Okay. Don't make the coffee and the coffee is too hot. The boiling water you make and put coffee. You spoil the benefit of the coffee. You destroy the whole thing. So we don't want that, because our coffee is not the normal coffee. Our coffee is therapeutical coffee, has nutrition. It comes with medicinal value. We can do a lot of wonderful things. We have lion's mane coffee. So if you put the boiling hot water into the lion's mane's efficient will drop. The Ganoderma efficient will drop. The cordyceps will drop. So why you want to waste it? The same goes to microVG. So don't mix microVG with very, very hot. Room temperature, warm water is good enough. So your coffee you make, don't boil the water. A lot of people make water while boiling them. This is another confusion, okay, by the consumers. All water they must boil. As the tap water also they boil. The chlorine water they boil. So this is not right. You just need to heat up a little bit. Okay? Just a little bit enough. So you mix it, you can drink. Just nice. So even for microVG, just use plain water is good enough. If you want to put the coffee, make sure the coffee is just warm or just hot, not boiling hot. Okay? Not boiling hot. Remember that. Okay, so our DXN products not in the boiling hot water. Like baby, when you mix milk, so you mix, you put it in your in your hand and you see the temperature. Okay, then you give the baby to drink. If you give a boiling hot water for the baby to drink, what will happen? The whole mouth will gone, finish, big problem. You see, we also have this kind of accidents comes to the hospital. You know, they forget to check, they will go and feed the baby with that boiling hot water. So no, it's not right. So like baby's milk, how we mix? We mix the water first, then we mix a little bit of hot water, then we shake it. See? So even that milk, you go and put the boiling hot water, everything gone. You never mix any beverages with boiling hot water, except tea. Tea is different. Okay, tea is different. If you're making a coffee, a black coffee, you know, you buy the beans and then you roast the beans and then you crush the tea, the coffee beans, and then you brewing. Brewing is different. So in that coffee, there is only coffee, no milk, no cordyceps, nothing. It's hard, solid coffee. So that is different. So like our DXN coffees is value. There's a lot of good things. So don't bring down the efficacy. Okay, we shall end our session here. All right.
Yes, Doctor. Thanks a lot for your kind wisdom, Doctor. Today's session is mind-boggling, and we are all really blessed and privileged. Thanks to Nixon sir also for a wonderful session, Doctor.
Yeah. Yeah. Thank you. Thank you. Yeah. Thank you so much. Yeah, to all the co-hosts, you know, Madam Miss Cho, Madam Parimalam, and also Mr. Sam, and also for the Nixon for the wonderful presentation. He has to leave earlier because tomorrow, day after tomorrow, we are having a recognition rally in Kuala Lumpur. So we are quite busy with that. And in fact, Miss Cho and Mr. David is also in Malaysia. I met them, you know, today, you know, so I'll be also seeing them tomorrow. They're also coming to my office. You know, we are going there, you know, so pretty packed. So it's two packed, all the appointments. So thank you so much, and let's end the session here. We'll see you all next week. Okay, so bye-bye, and thank you.